Hi, my name is Rachel Corbett, and I am an occupational therapist and certified driver rehab specialist. I work for Easter Seals in Meriden, Connecticut. Today, I'd like to talk to you about an MD screen that could be used to assess the need for a driver assessment. Safe driving is no accident, and screening patients for the need for a driver assessment can help to prevent accidents in the future. Studies show almost everybody believes that they're an above average driver. Most people also think they're better looking than their driver's license photo. While this cartoon is amusing, it does speak to the fact that many people lack insight into their deficits that could affect their safety behind the wheel. These are some funny examples of driving behaviors that most of us have encountered on the road. A lot of older drivers tend to not use their signals and or are in the habit of not using their signals, which can result in people not understanding what another driver is going to do and can result in a crash. For people that have maybe impaired acuity or impaired depth perception, they often brake frequently when approaching other vehicles, going downhill, or approaching curves in the road because they're unsure of these things or of how far they are away from other vehicles, which can result in accidents. And all of us, as we age, our overall processing speed, both visually and cognitively, can slow down, which can result in missing road signs, road markings, and having a delay in responding to seeing these signs, therefore waiting until the last minute to merge. The learning objectives today are to explain the benefit of screening patients for fitness to drive at annual physicals, to provide you with ICD-10 codes that may be billable to address driver safety, to provide you with questions to ask to determine fitness to drive, and also to explain the referral process for a driver assessment. Why screen patients for fitness to drive? Well, for one, most people are living longer and they therefore continue to drive for longer periods of time. All of us, as we age, typically experience some type of physical, visual, or cognitive changes that could affect our safety behind the wheel. Perhaps you've had a patient that has come into the office whose family member or friend has voiced concerns over their ability to drive, or maybe they have expressed that the patient is getting lost or has had a near miss when driving, or they might have some dings and bumps and scratches on their vehicle with no explanation as to how those things wound up there. It's also a good idea to get a baseline on the patient's current driving status to determine if maybe there have been some changes that negatively could impact their driving abilities. And it can also be looked at as a preventative measure to prevent future accidents and injuries from happening. What ICD-10 codes may be billable for addressing driver safety? Below is a list of codes that could possibly be used during an annual physical to bill for addressing driver safety. On this slide is a driver assessment screen that can be used at annual physicals. If a patient answers yes to at least two questions and they have a medical condition that could affect their safety behind the wheel, a driver assessment is recommended. Also, if you are administering the MOCA, a score of 24 or below indicates that the patient would also benefit from a driver assessment. If you complete the screen and it is determined that a driver assessment is indicated, we do require a referral in order for a patient to be seen. The referral form can be found on our website, and we also ask that you include the most recent visit note, past medical history, a list of medications that the patient is currently taking, and the best contact person for scheduling. All of these forms can be either faxed or scanned to our email. What is the cost of a driver assessment? Unfortunately, driver assessments are not covered by insurance except for workman's compensation. We do recommend to our clients that they can try to submit the clinical evaluation to their insurance as they may be partially reimbursed since I am an occupational therapist, but we do let them know that this is not a guarantee. The assessment is broken down into two parts, the clinical assessment and the behind the wheel assessment. The clinical assessment can be completed either in office or via telehealth. If someone comes into the clinic for the clinical, the cost is $400. If they are completing the clinical via telehealth, the cost is $275. If the person does a telehealth clinical assessment, they are required to come in to the clinic before getting behind the wheel to complete the testing that we were unable to do on the computer. The second part of the assessment is the behind the wheel piece, which is $175 if someone has paid the $400 for the clinical, or it is $250 if someone did a telehealth clinical and needs to still complete some part of the clinical prior to driving, or if someone is in need of adaptive devices for driving, such as hand controls or a left foot accelerator, then the behind the wheel piece is $250. Thank you for your time, and please feel free to contact me with any questions that you may have. I can be reached via phone, the phone number is on the screen, or via email. We are located at 158 State Street in Meriden, Connecticut.